The following is the recording for the Occupational English Test, and the test is held at Medcity International Academy, Kannur, on the 16th of October in the year 2024. The candidate with me is Dr. 𝐎𝐞𝐲 𝐿, and the candidate number is 6342. The interlocutor is 𝐿𝐢𝐿, and the interlocutor number is 8415. This will be roleplay number 1 for the profession of medicine. Good evening, Dr. 𝐎𝐞𝐲.
Good evening.
May I see your identification, please?
Yeah, sure. Here's my passport.
Thank you. Okay, here you go.
Thank you.
So this will be a test of your English language and not in any way an assessment of your professional medical knowledge.
Right.
Bear that in mind and speak as you would naturally in any situation. I will take you through a warm-up session so that you could get accustomed to this environment. The session is not in any way assessed.
Right.
So, Dr. 𝐎𝐞𝐲, why did you choose to become a doctor?
Well, it has always been my dream since childhood to become someone very prominent. And I've had multiple hospital visits as a child. I was not that really healthy early on.
Right.
I've seen too many doctors, and I've had this feeling that yes, I too should be one as I grew up.
Right.
And that has been an inspiration to be a doctor.
Okay, that's very nice to hear. Have you had any experiences that made you proud to be a doctor?
Well, yes, several, I would say. I mean, every day I think, I feel proud and gifted because I'm able to help so many people that I meet every day. To be able to bring a smile on their faces is something I think is divine. And a recent experience is I was traveling and I happened to be on a railway station, a platform, and I just saw somebody collapse all of a sudden, and the doctor in me, of course, wouldn't let that go, and I could save that person. And the first aid that I was able to give really helped him come back to life. And yes, probably if I wasn't a doctor, I wouldn't have had the courage to do something like that, but being one, I was able to help. Yeah.
Okay, that must have been great.
Yeah.
Right place, right time. So how do you think medicine has evolved over the years?
Well, lots and lots of changes. I'm sure everyone is aware of what's happening in the field of medicine these days. You can see things evolve quickly. If you consider anything, probably there were diseases that were thought incurable. We have solutions for that now. Too many over-the-counter medications available, so everything is in your reach. Be it from lightening your skin to a skin condition or anything of that sort. You have medications available with a doctor and easily available over the counter as well.
Right. Okay, we'll end the warm-up session there and move on to the actual role play.
All right.
I'll be taking the part of the patient and you'll be taking the role of the professional here. You will be the doctor.
Okay.
The role play will last a total of 5 minutes and you will be given 3 minutes to prepare for the same. The role play intends to get evidence of your ability to effectively communicate with your patients. Okay. Do you have any questions now?
None.
Okay. So you will have 3 minutes to prepare for this role play. You can make notes on the role play card if you wish to do so. Here is your card. Here is a pencil.
Thank you.
You can look at the card as many times as you want during the role play, but at the end of it, I'll need that back.
All right, sure.
Okay. So you can start preparing from now. Okay, Dr. Sangeeta, that will be the end of the time given to you for preparation. Okay. We will now move on to the actual role play. We can start now.
Hello, good morning. I'm Dr. Sangeeta. Happy to see you here. From the looks of it, I think you're in some kind of discomfort. How may I help you today?
Hi, my name is Thomas, and as you can see, I am very, very old. I attend regular chair exercises as I have difficulty walking, and I also use a walking frame.
Right.
I'm just concerned about my lower back right about here because I feel a lot of discomfort there since this morning. That's why I'm here.
All right, to get started with, may I know how old you are?
I am ancient. I'm 86 years old.
All right. All right, Mr. Thomas. I would need a little more details to be able to find out the exact problem that you're in. So if I may ask you these questions, can you tell me exactly where the discomfort is located?
Well, it's actually in my lower back. I'm not really in much of pain. It's actually just discomfort.
All right. So you mean to say you don't feel any kind of pain as such?
Not in particular.
But just a mild discomfort?
Right.
In your lower back?
Right.
Is that right?
Yes.
Do you think it could be because of anything that you've encountered, like an injury probably that you've had, or you spoke about the exercises? Could that be the reason?
Well, I don't think that's the reason, because I haven't had any injuries recently.
All right, noted.
And I've been going to regular chair exercise classes.
Right.
And nothing happened during class yesterday. I only noticed the discomfort this morning after I got out of bed.
All right. Okay. So it possibly could be a strain on your lower back, a mild strain to be exact. And there could be several reasons for that, like probably overstretching of your muscles or your ligaments. This would have happened either while you were doing your exercises or during your sleep. But relax, that's not of a huge concern. So what I can advise is that I do a complete physical examination so that I can confirm the diagnosis that I've just made. Yeah, that would be the first thing I would require.
Okay.
And the second is I would recommend that you take a week's off from your exercises. You know, it's not advisable to exercise when you feel discomfort or pain. You shouldn't be ignoring that.
Right, I understand that, but I'm not actually in any real pain, so I don't think it's necessary for me to miss a week of classes, especially when they're helping me a lot.
Right, Mr. Thomas, I understand how important these exercises are for you, these classes are for you. And yes, it is important to exercise regularly, like you've said. You know, you're using a walking frame, so these exercises are really important, vital for your you know, continued progress. But to ensure that no further injury happens or the muscles that could be strained, you know, you give it time to recover. It is vital that you take some time off, right? And at the same time, I would also advise, I mean, it would be great if you can try out a heat pack, okay? Or even paracetamol will help.
Now I'm starting to wonder if these exercise classes are actually for me, or should I maybe just stop doing them?
Right. Yeah, I get what you're feeling right now. Well, I would never say that the exercises are not beneficial or that they're not meant for you, right? You're doing chair exercises, and these are done to ensure that you don't strain your lower extremity too much, which is why you're using a chair for support for your exercises. So I would say this is the apt form of exercise for you at the moment, you know, considering your age as well.
Yes.
Well, exercises, as you're already aware, probably helps improve your posture. At the same time, it also ensures muscle strength. boosting of your energy. And I'm sure you'd meet so many people when you go out to exercise, and that's vital for your, your healing, your improvement. So I would never say and never ask you to stop exercising. All I would say is you need to keep a watch on it, and don't exert too much. You should ensure you're not overdoing it.
Okay, Dr. Sangeeta, that concludes your speaking test. Please return the card to me.
Thank you so much.
Thank you.
Medcity International Academy. Trusted hands forever.